Good afternoon, everybody. It's Thursday, the 3rd of September, and I would like to welcome you to the Aberdeenshire Council Hospitality Businesses COVID webinar. This is the second webinar this week, and we have a lineup of 5 speakers from both council and partner agencies. My name's Louise Cunningham, a team manager within environmental health, and I'll be your chair for this afternoon. The first speaker we have is Dr. Simon Hilton, a consultant in public health medicine with NHS Grampian, and he's going to provide an overview of COVID-19 and the background to where we find ourselves. Thank you.
Okay, thanks, Louise, and good afternoon, everyone. So as Louise said, my name's Dr. Simon Hilton. I'm a consultant in public health medicine, NHS Grampian, and I'm just going to spend the next 10 or 15 minutes just doing a little bit of scene setting, and I'm going to do that in 3 parts. Firstly, I'm going to just give you a bit of information about the sort of structural context around some of the terms that you'll have probably heard in the news around things like IMT, Health Protection Team, Test and Protect. So just a little bit of background information as to what do all these things really mean. I'm then going to tell you a little bit around COVID and this particular pandemic, where we've come from, what's been happening so far, and where we find ourselves at now, and what we're trying to do around it. And then thirdly, I'm going to bring those 2 things together just to sort of really set the scene for Aberdeenshire and Grampian at the moment. So in terms of the first of those, within NHS Grampian, we have what's called the Directorate of Public Health. And within the Public Health Directorate, we have the Health Protection Team, which was a fairly small team of people, including myself, but which is certainly rapidly increasing in the context of COVID-19. And within the Health Protection Team now, we have the Test and Protect team. So when you hear people talk about Test and Protect on the news, we have national Test and Protect teams and local Test and Protect teams, and the local team very much works with ourselves. And the reason for that is the Health Protection Team, our purpose is really around protecting the health of the public, primarily against infectious diseases and environmental hazards. And the Test and Protect Team have really been brought in and added to the Health Protection Team to help us do that specifically around COVID. And we do lots of things every day to protect the health of the public, but one of the tools that we use less frequently is what we call an IMT, or Incident Management Team. And so this is what you will have heard about on the news in relation to the Aberdeen City Centre cluster that we've experienced. And what the IMT is it's when we perceive a particularly significant threat, and often a complicated threat to the health of the public. We actually convene a group of stakeholders together in partner organisations who actually have specific knowledge and expertise around the subject that we're looking at, but also who are able to take action in relation to it as well. And we've got a long history, I think, in Grampian of working very closely with all our partner organisations, and I would say certainly over the past few months that has gone from strength to strength, really. So that's what the IMT is, and really an IMT is pulled together, as I say, when you have a particularly significant public health threat, and basically the IMT makes difficult decisions. By definition, the fact that you've pulled an IMT together means that there are no easy answers. So I think it's important just to give that bit of context. So hopefully that just gives you a little bit of an idea of what we mean by IMT, Test and Protect, Health Protection. In terms of COVID-19, I think the important thing to say right at the start is just remind people that this is a complex disease. And when I say complex, what I mean really is that there's lots of things that we still don't know about it compared to other infectious diseases. And that applies to both the virus and how it behaves and who it infects when, but also the testing for the virus as well. And so it's important to keep these things in mind because they affect a lot of our decision making. And really makes the decisions of groups like the IMT even more difficult. But just to go back to a stage, in terms of COVID-19, so just to sort of give you a feeling for the journey we've come on so far leading up to today. If you remember back many months ago when the pandemic first came along, the COVID-19 pandemic first came along, we had what we called the containment phase. And what the containment phase is when we don't have the virus in the population, and so essentially we try and contain it and try and stop it getting into the population and spreading. Now we know with a respiratory virus such as coronavirus, flu virus. These things spread really quite easily, really quite rapidly. So containment is only ever going to be something we can do for a certain amount of time. And often it is a case of buying time to give us time to find out more about the infectious disease, about the virus, how to treat it, how to manage it, that kind of thing. And I guess at this point, it's maybe just worth reminding people coronaviruses are not something that are new. The coronaviruses are common, but it's obviously the issue with COVID-19 is that it's a particular type of coronavirus that we don't really have experience of. So having gone through the containment phase, the next phase is the mitigation phase, and that's probably the phase that we've been mostly in for the past few months. And that's where the virus starts to spread in the community. And so we're no longer able to control the spread very easily, but we can try and mitigate the effect. So, for example, one of the things that as a health protection team we've been doing a lot of during that period is working with care homes, because clearly they have a very vulnerable population, as we know. And so we've been working closely with them to try and stop the virus getting into care homes, or when it does, try and stop it spreading through the care homes and causing some of the effects that we have seen. And we haven't obviously been working exclusively with care homes, but they have been a particular focus. And now we're really into a bit of a mix of those two things, where we know the virus is in the community, we know it is out there, but what we want to do is we want to try and stop it spreading as much as we can generally. And maybe to explain that, it's worth referring to these R values that, again, I'm sure you've heard mentioned in the news. And essentially what an R value is it's really about every time a person becomes infected, how many people do they spread that infection onto? So if you can imagine, for example, on average, for every person who becomes infected, they spread it to just one more person, then that would be an R value of 1. And so what that means is that the virus will gradually spread throughout the community, but it won't particularly increase and it won't particularly decrease, because one person spreads to one person on average. If every person infected spreads that infection onto 2 people, then you can imagine those 2 people each spread it onto another 2 people, and so it the rate and the amount of virus in the community increases exponentially and really quite rapidly. And again, you've probably heard people talk about doubling times and doubling effects, and so that would essentially be an R value of 2. What we're really looking to do at the moment is keep the R value below 1, because if we can keep the R value below 1, that means that we're stopping it gradually spreading. There will be some spread, but it's trying to reduce it and gradually reduce the amount in the community. And if you can manage to do that consistently, then the prevalence, i.e. the amount of virus in the community, will gradually decrease and hopefully eventually fizzle out. We're certainly a fair distance from that, but that is the aim now. And the way we do that is by identifying people early who have the disease, and then doing contact tracing to basically try and stop them spreading it around. Now, contact tracing is essentially, that's the job of both ourselves and the Test and Protect team. It's not something that's new to us, it's something that we do every day. It's our bread and butter, really. But the Test and Protect team are there to give us some extra resource, extra capacity to do contact tracing around COVID-19. And so the idea is, if somebody's infected, you identify them, but then you also identify people around them who may have been in close contact with them, and therefore who they may have already passed the virus on to. Clearly, some of those people won't have had the virus passed on to them, but some will. And if we can identify all those people and then stop them spreading it before they even test positive or come back as being cases, then that's how we stop the spread more effectively. And essentially, it's what we call breaking the chain of transmission. So it's just stopping those opportunities for the virus to spread from one person to another. And so that's really the aim of Test and Protect. I think it's really important to say that the key messages for the population, for yourselves, remain the same, and it really is around social distancing. We have certainly seen, and there is increasing evidence just how important this is, because we see that where social distancing breaks down, the virus does transmit, and we do see clusters of people where they haven't had that distance, and the virus transmits between them. And so we've seen a lot of clusters within households. Obviously, people living together who aren't socially distancing can spread it really quite easily amongst themselves. And that's part of the reason that we also try and isolate household contacts as well. So again, identifying people early, getting people tested early when they have symptoms, and isolating them, and basic hygiene. Again, we talked a lot, especially in the earlier days of coronavirus, of COVID-19, around hand hygiene, washing hands, and that is still as important as ever. So that's a little bit around COVID-19. So just to finish off, so where does this bring us to in Aberdeenshire, and indeed in Aberdeen City, Moray Grampian more widely, in terms of the COVID pandemic? So we convened an IMT some weeks ago because obviously we'd identified that there were a number of cases that appeared to be linked to each other and appeared to be linked to the hospitality industry in the city centre of Aberdeen. We worked closely with partners. We convened the IMT. One of the challenges we had was interpreting the data and really understanding where the links were and who was linked to who and who were linked to what particular settings. And that was quite a big job. But again, that's because of all the unknowns we have around the virus and the testing. But we identified that we had an outbreak linked to the centre of the city, in Aberdeen. We believe that outbreak is now over. We've actually declared that outbreak as being over. We were aware that as well as people who were directly linked to that, though, we did have a higher prevalence or a higher number of cases of COVID generally in Aberdeen and also to an extent in Aberdeenshire, although the prevalence in Aberdeenshire wasn't as extensive as City, but we were aware there was an issue there, and obviously viruses don't adhere to local authority boundaries. So we've monitored that really quite closely, and as well as the outbreak linked to the city centre being over, the number of cases in Aberdeenshire and City who aren't linked have also come down. So that's been a really positive thing. And the reasons for that are potentially quite complicated. Some of it could be due to increased testing, but we actually also know that out of all the people we were testing, the positive rate wasn't hugely high, so it wasn't just the amount of increased testing. There did definitely seem to be more cases of COVID out there, more people with COVID. So we're at the stage now where, as I say, we've stood down the Aberdeen city centre outbreak. The cases have generally come down, and so really what we're doing now as a health protection team with our partners is, and we have been very much working with colleagues in our partner organisations to look at how we identify any future clusters early, how we get on top of them, how we try and break this chain of transmission using our test and protect team to contact trace and try and test and isolate at the appropriate time to try and to stop the virus having that opportunity to spread around. And so that's really our focus going forward. That's all I wanted to say to you this afternoon. I hope that's useful. Thank you very much. I'm happy to answer questions, obviously, as we go.
That's great. Many thanks, Dr. Hilton. I'm sure you all found that really useful to recap some of the key phrases and information surrounding COVID-19. Our next speaker this afternoon is Dale Henderson, Principal Trading Standards Officer from Aberdeen City, who will be going over some of the lessons learned by Aberdeen City in relation to COVID-19.
Good afternoon, everyone. Obviously, I work for Trading Standards, but we work with our environmental health colleagues, and we've worked throughout the pandemic on enforcing the coronavirus regulations. We have for a number of weeks worked with the hospitality businesses in the city to ensure that they have the advice and they're complying with the law. But more recently, when we had our little local lockdown, we were required to visit, it was approximately 160 premises over a period of 7 days. Those visits were undertaken by Trading Standards and Environmental Health, and we spent an hour to 2 hours with most businesses. We basically went through a questionnaire, but the idea was to check compliance with the regulations and the statutory guidance, but also to give advice and to answer questions and to help sort out any issues that business might have. Our view on this has been the same all throughout, whether it's in between the lockdowns or now. Every single business is trying hard. We've not encountered any business that is not trying to comply with the law. They all want to comply with the law because they want to get back on their feet. We want to get customers through the door, and it's better for everyone if we've got all hospitality, operating at as full capacity as we can. Um, we've also were out at the weekend there. We went out on Friday and Saturday night just to see how things worked in practice. Because obviously we had the mini lockdown, it meant that most of these second visits were done when the business was closed. So we went out just to see how it was working in practice. But this is the point of what I'm going to say is the lessons that we've learned or the main issues that we have encountered when we're out and about, the main things that are maybe causing questions or causing confusion. And I'm not going to say it's not confusing, and I'm not going to say it's always logical, because I don't think we all think it is logical sometimes, but it is what it is. One of the first things is the mixed household groups. If you're lucky enough to have an outdoor beer garden and people brave the weather, then obviously you can get 5 households. But if it's inside, it's 3 households. But then the thing to remember is these households have all got to be kept apart. So what you're going to need is a bigger table. So if you go 7 months ago and 3 friends came in to a bar for a drink, they can sit at one of them small round tables. Now there's got to be a metre between them. So that's making space. You've got more space for less people, and that is a problem. The other thing with the distance, we have had a big problem in Aberdeen with a bit of confusion around the fact that it's people that must be apart. It's not the furniture. So you put your furniture in and you measure between tables. It's not that. You've got to put somebody sitting in the seat and then put somebody sitting in the seat behind them, as it were, and measure the gap between the people. And things to remember is if people are in for a meal, they're going to sit much closer to the table than if they're out for a drink watching football. Another problem area in a lot of places is toilets. The access to the toilets can sometimes be difficult. They can be along narrow corridors, downstairs, upstairs, whatever. But so you need to manage access to toilets, both how many people can you get in toilets at a time, and how do they get in and how do they get out safely. The statutory guidance will say you are not allowed queues inside premises. Our view is that I think that's got to be impossible for many premises when it comes to managing toilets. In some bars you can, some small bars can do it with no issue, but in most bars you can't. So you're going to have a queue for your toilet. Again, that's got to be well managed. Everybody's got to be a metre apart. It's got to be a metre apart from every other person in the premises. So that can become difficult. So you've just got to watch that these things don't become unwieldy and make it difficult. So you might need signage up and just gentle reminders to people. Capacity of venues, that's another thing that's more in big places than smaller places is how many people do you think you can get in? And certainly in big places, there's maybe been an overestimation sometimes. I would argue that your capacity is extremely flexible. It'll depend who your clientele are, what day of the week it is, how many staff you've got working, what's happening. This Friday night there's a Scotland football game on. That'll be a different clientele than people who are out for a drink on a Tuesday night. Other questions that have come up, certainly in small bars, your local bars, is can we not have seats at the bar? And certainly there's some people struggle to sit in low seats, so can they have a seat at the bar? So, our advice is, in an ideal world, we don't want seats at the bar, but in practice, then yes, you can, possibly, but you need to have it risk assessed. So you have to look at where the bar is, where can you put the seats. It might just be one seat for one particular customer. You just need to make that clear, make sure people don't hang around, make sure there's a metre between that person and everyone else. Certainly bars in Aberdeen are managing it, so it's not impossible. Another issue that keeps cropping up is face coverings with front of house staff. If you go to move down to a metre, which I think all hospitality have done, then there's a requirement for face coverings to be on front of house staff, unless they are behind a screen or they're going to be 2 metres away. If somebody cannot wear a face covering, then they will really have to move to a different task. So instead of being on the bar floor or on the dining room floor, they might have to be behind the counter. They will have to remain 2 meters away from other people in that instance. Booze is another question that came up as to, you've obviously got booths that are back to back. So the advice we're given in the city, if the back of the booth is higher than people sitting down, then we're happy with that. There's a question mark as to whether it had to be higher than somebody standing up. But we've taken the view that people standing up and moving is transient. So as long as the back of the booth or the perspex screen that you add, or any screen that you add, is higher than an average person sitting down. So not someone that's 4'11", but someone that's an average height, then that would be fine. And I was out on Friday night, and this is two things that are not about the bars, but this is about your customers, is smokers. Smokers huddle together. They sit great, you bring them into the bar, you sit them apart, they follow all the rules that you put in place, they go outside for a cigarette, and they all cuddle up to each other. I saw on numerous occasions on Friday night. That's not the bar's responsibility, that's the individuals. But I would say if you've got a smoking area, it would be great if you could put signs up just to remind people to stay apart, because they just forget. We all forget. We all do it. None of us will say we're perfect at it. And the other thing is that customers have to take responsibility. So I think a lot of what you're going to be doing is just nudging people. Is hopefully not having to be, shouting at people and putting them out the door, but it's just gentle reminders, because people will forget. It's their pals they're speaking to. Why should they not get too close to them? So I think a lot of that's what we're saying to businesses, is just gentle reminders to customers to keep apart. We know in the city over the last week we've had an awful lot of focus on bars and issues. So we've got, every minor issue is getting reported to us. So we've got a little team at the moment who are following up on all inquiries and complaints. And it's not about us going out, wagging our finger and saying, you're doing something wrong, we're going to take enforcement action. It's not that. We want to go and help the business and find ways to help them comply. And so far, we're hoping, fingers crossed, that it's working. So hopefully these lessons will help you in the future.
Many thanks, Del. Just a reminder to all attendees, if you have any questions, please pop them into the live event Q&A, and we'll follow those up after our speakers. Our next speaker this afternoon is Keith Simpson, Senior Licence and Standards Officer within the team here at Aberdeenshire, and he's going to discuss hospitality mitigating measures. Thank you.
Yes, thank you, Louise, and thanks for inviting me to address you all this afternoon. For those of you that don't know me, I'm Keith Simpson, one of the 4 licensing standards officers across Aberdeenshire. Those of you that are in the licence trade will be well aware of the role of the LSO, which is to provide guidance and assistance, act as mediators in the event of disputes, and ensure compliance with the Licensing Scotland Act 2005. Although this remains our day job, we are authorised under the Coronavirus Scotland Act 2020 to ensure that the regulations contained therein are being complied with. During my presentation, I will go into this in more detail. But before I go into that, I'd really just like to say a thank you to all the high levels of compliance that have been achieved thus far from all of you in the hospitality industry. There's a general agreement that most businesses have put all the necessary procedures in place, and in the main, your patrons are trying their best to comply. Unfortunately, human nature being what it is, there are always going to be some of them that want to make your life difficult, especially once alcohol is in the mix and inhibitions are lowered and common sense tends to go out the window. There's also a full understanding from council officers of the impact the pandemic has had on your respective businesses. I can only imagine the pressures that have been brought to bear on you, and hope that there is some light at the end of the tunnel. I suspect that I'm and I'm already hearing that some businesses will not reopen, but hopefully these will be few and far between and many businesses can survive as possible. It's therefore imperative that all the measures are maintained to try and minimise the risk of the transmission of the virus, and that we can continue to move forward. I'm sure you will agree that we want to prevent the situation that Aberdeen City unfortunately found themselves in, with further localised lockdowns is not what we want. So please, my message to you today would be make sure you keep up the good work. Today I'm going to run through the requirements that each and every one of you have on a day-to-day basis, and you need to comply with as you go forward. Much of what I will cover may be well known to you, but it will hopefully act as a reminder of perhaps enhance your understanding. Okay, so the first slide that I've got today is really that there's again three main measures. And this has come from the 24th of August. I meant to say actually these are updated from the 24th of August, not the 14th, as I said before. Three key issues here. Noise control is something that we do take a lot of cognizance of. Initially, there were pubs, hotels, clubs, etc. were allowed to have some low-level background music and televisions on, but a very low level. This has now been changed, and there's to be no background noise from televisions, jukeboxes, etc. And if televisions are on, they've been to be put on mute and subtitled. I think we all accept as well that when they've got a football game or something on, it's very difficult to not get involved and jump about and shout, etc. But these measures are meant to be in place to try and keep people, to save them from raising their voices and try and shout above other people. So these measures are in place to try and alleviate that. Loud behaviour, that's really, again, the same sort of thing. Anybody where there's customers that want to shout or sing, that should be challenged by the licence holder or the staff on duty that day to try and make sure that that's kept to a minimum, if not eradicated. It's not to be accepted at the moment. And the third thing there is some queue management. Again, queue management, it's the default position for queue management is 2 metres, and as I think as Dell from Aberdeen City said, it's very difficult indoors. We're not anticipating there should be queuing, but where there are potential for, say, toilets or whatever, it's only natural that there mightn't be that slight requirement. If we do have queuing, sometimes outside, that can be for collection of takeaways, services, etc. Again, just really to emphasise that the 2 metre physical distancing is the default position there. And the diagram that's on that slide really just to explain how different households work, how you have to have 2 metres between the households. So although there's maybe 4 people in one household, they can come together, but then there's 2 metres to the next household, etc., etc. Some other things that have come into effect from the 24th of August. Again, we'll be very much all aware of this. The collection of customer, visitor contact details to support the test and protect. I think that's all well documented, but again, this is a legal requirement to do this. In short, there's 2 sides to this. I think the main thing would be that you have to look at it from a staff perspective first and foremost, to make sure you log obviously your staff that are on duty, the details of them, dates and times that they're on shifts, etc. You'll probably have that because that's part of your for the pay, etc. You want to know where they're on, but for customers and visitors, that's also the same. We're wanting the names of customers, contact telephone numbers, dates and times of in and out the premises, and where you can't or there's not a position to give a phone number, an email address, or would actually suffice as well. But it's important that we do that, and any other visitors that might happen to come to your premises. Physical distancing, capacity management and no crowding. I guess, again, this has kind of been covered, and we've said that 2 metres is the default position in most scenarios, except for in the hospitality business where you can use the exemption to go down to 1 metre with the physical distancing. So all these things are in place, and I guess from my experience of over the last few weeks and months, the majority of complaints, if you like, or people making representations against compliance is on this basis, where they're seeing premises that are not engaging or taking control of situations where this physical distancing is not being adhered to. I guess that the advice to the hospitality industry was that we all accept that you try your best, and I think that's all we can really ask. You could be compliant 1 minute with everybody physically distanced by a meter, and the next minute somebody, human being, just decides to go and speak to somebody else too close. You can try and control it the best you can, and that's really what we're asking for. But we do appreciate it's not always you can be 100% correct at all times. So just bear it in mind. But I'm sure you'll do your best on that. The 1 meter zone, again, you need signage for that, so that you're in a 1 meter area. I think that's well documented as well. Cleaning and hygiene arrangements and management of the toilet facilities. We are anticipating that there are robust cleaning regimes in place around all shared and hard surface contact areas, the toilets, door handles, tables and chairs and service items. And equally, facilities for regular hand washing or sanitising is the best effective measure to reduce the risk of transmission, and that should be routine practice in premises for staff and customers. But again, my experience is that most premises are certainly complying with that and have all these facilities in place. Couple of other issues there: the table service and no standing, all customers seated. Again, slightly covered before. We are expecting that the table service is the norm, or certainly a default scenario. Where there is collection from a bar, that we wouldn't want queuing, and we are expecting that there's to be no standing at the bars. These are all in place, and we do expect that to be the case. Improved ventilation, again, that's just, it makes kind of common sense. We're looking to do your best, and where you can, if the weather dictates, to open windows, doors if necessary, and that would be appreciated. What I've done here is just put up a few slides which kind of describe, or they're examples of how parties can mix, and limiting the households and mixing indoors. We mentioned before about the 8 people from 3 households indoor and 15 from 5 households outdoor. So this really just gives you the diagrams which show, on the top left diagram, you can see a 1 table where you've got 8 people around 1 table, but that's because they're all from 1 single household, which is perfectly fine. You then go to the middle slide, or the middle example, and you see that there's 2 households, each with 3 people there, but they aren't separated by a meter. So again, you've got to accept you need to build in more space, bigger tables, etc., to try and alleviate that problem. And the third one there is where you've got 3 households, and it could be, again, 1, 2, 3 people in each household, but each of the 3 households needs to be separated by the meter distance. The next slide is just a slightly bigger example of how it may look if you have a hospitality business, a restaurant or a cafe or bar. And it's just really to illustrate, again, without going into huge amounts of detail, how the groupings in this scenario would be maintained. The top left diagram really does show that the tables are separated by a meter, but what we've also had to factor in there is where there's a walkway or where there's staff having to service these tables, it actually really makes it look like it's 2 meters you need to be, because you need to build in that extra bit of distance between the tables. The bottom right diagram is a diagram which shows where there's actually barriers, and again, that was discussed where we have booths or barriers or something that's high enough to differentiate between the tables. There's no difficulty with those without having to have physical distancing between the barriers. But where you're on the other side and where staff are walking up and down, you would need the meter either side of that person there. So I hope that's self-explanatory. It's just really a guide to you there, and it's not really a major science. Some other quick ones that are really just to cover that are a bit more recent from the 24th. Don't want to go into great detail. Amusements and games, and really that's to do with the facilities like fruit machines, pool tables, dartboards, that sort of scenario. From the 24th, fruit machines and pool tables were allowed to be recommenced. They have to be risk assessed. They need to be subject to robust cleaning procedures, ensure physical distancing can be observed, and are not located in thoroughfares. A good example of something that I had from a hotelier in the Bankery area was where he was deciding to actually just have people playing pool at an hour slot. So they booked the table rather than people having 50 pence down and winner stays on. They were having it. You could have an hour slot on the pool table, and then it was cleaned down, and then another 2 people would play pool. So I thought that was quite a sensible approach. It saves a lot of people gathering around the table, etc. Fruit machines the same, cleaning. And really, that's just we're getting through these things, and things are becoming a bit more normal. Face coverings is a big issue, I think, as well, possibly for staff. We know that the customers themselves, there's no requirement if you're in an eating and drinking premises. That's slightly different for bingo halls and casinos. But in the normal eateries that we've got, there's no requirement for the customers. But there is an expectation that the staff will, when they're certainly waiting tables, etc., and unless they've got a pre-existing medical condition where they can't use face coverings, that we would be asking that they actually perhaps were given another role, not so much front of house, but there is the expectation that face coverings are used by staff. Covered again, bingo halls, default position there is when they're playing bingo, that there should be 2 meters is the default position for physical distancing, and face coverings should be worn in casinos and bingo hall, except for when they're consuming food and drink. But I think there's sometimes the food and drinks element is slightly different in bingo halls. Few questions we have had are about where bingos are played in, say, private members clubs or pubs, and possibly things like pub quizzes as well. And we might find that those are questions that are asked later on, so I'll not preempt if anybody's going to ask questions like that. And finally, some adequate provision for key information on the training of staff. We do expect that you, as hospitality businesses, licensed trade, etc., keep your staff informed of developments. The licensing standards officers have taken a lot of time to make sure that we try and get out to as many licensed premises to give them updates as they come in, provide them with the guidance as necessary. And there's a link there at the bottom of that slide, which is the tourism and hospitality sector guidance, which is available to you. So we do try and keep you up to date, but we expect you to impart that to your staff in your training regimes. Just a couple of things that the government are looking to explore. This is a moving position all the time, and we're really not sure whether these will come into effect, but they're looking potentially to there might be measures to limit number of premises visited in a day. I guess that's really to try and stop the idea of what might be deemed to be a pub crawl or hare and stag nights, where people are going from one pub to another, to try and limit them to prevent the spread of the virus. Entry cut-off points will be the things that maybe perhaps when businesses are near capacity, or they feel that things are out of control, they will shut early, or they'll restrict their hours so that they can keep things under control. I think that would be welcomed. I know of many occasions of where premises have not been sure about how things were progressing and could see problems. They immediately shut their premises and got people to go home. And I think that's a proportionate measure if you feel that there's anybody at risk. Face coverings within premises for customers when not eating and drinking. I guess that's self-explanatory, but I'm not sure whether that's on the cards at the moment or not. But as I say, these things will be kept under constant review, and any updates will be provided in due course. Very quick definition of indoor-outdoor areas, just in case it is. We were certainly in the early days, we were encouraging people to use outdoor spaces to be licensed. We had occasional licenses to cover it in some occasions. But in a nutshell, what we are defining indoor areas and outdoor areas as, if you can see on the slide, the left-hand photograph is almost like a 3-sided marquee with the front side open. Because it's enclosed on 3 sides with a roof, this would be deemed to be wholly or substantially enclosed and would be an indoor area. Therefore, you need to comply with the the 8 people from 3 households scenario. It's the definitions taken from the smoking legislation, which we would deem that to be an indoor area, and you wouldn't be allowed to smoke in there. So we've adopted that sort of scenario. So that would be an indoor area. The other picture is of what you might call an umbrella type parasol with heaters in there, and because it's got no sides, it's got a roof but no sides, it would be deemed to be an outdoor area. So you could look at that as being outdoor and could apply the measures that you need to for that particular outdoor area. Enforcement, I don't want to maybe cut across the police in this in any way. I know Sergeant Flett's coming on to this later on. I mean, we adopt the 4 E's, and I think environmental health will touch on this as well. 4 E's really is to engage. If we find any difficulties, we want to engage with the hospitality businesses. We want to make them aware that there's either been a complaint or we're aware of something that's not quite right. In the case of something that's not right, we want to make sure you understand. So there's a bit of education to be done, and then a bit of encouragement to make sure you can then comply. And as I say, the enforcement is really only the last resort here, and it's not something that anybody's here to do. We're not here to beat you with a big stick. We want yourselves and your patrons to comply with what's been asked for, and that will alleviate any need for enforcement action. Again, just a brief word on partnership working. We've worked very closely throughout since the outbreak and the lockdown measures. We've worked very closely with environmental health, trading standards, building control, roads. There's all sorts of people have been involved in trying to help businesses get up and running again post lockdown. We work particularly closely with Police Scotland. Police Scotland are very good at, when they're out and about, obviously in their patrols, they will make us aware of certain things that they see that they're not happy. They will engage as well and educate where required. We've got enhanced protocols with Police Scotland we'll have a weekly brief with any issues we've had, particularly over weekends. So we'll know what's happened by a Monday morning, and if we need to contact your business to say, look, maybe that didn't happen, didn't go too well at the weekend, we'll bring that to your attention and see how we can try and mitigate that from happening again. And really, again, only persistent non-compliance would result in any sort of prohibition notices or whatever, but it is the last resort, and we don't anticipate that being required, or we certainly don't want that to be used when we're under the last resort. We have got some new powers which might be touched on later on, which have come out as well, which do give us the chance to deal with premises and events and things individually, and there are more powers to potentially shut down these things in the event of non-compliance. But again, we'll wait and see how that goes. Advice and support, really all that is just some contacts, contact emails, addresses for the LSOs, environmental health, and we can find on Facebook and Twitter, etc. Guidance is all there with the links, and realistically, I'm happy to take any questions and answers on the completion of the webinar, but for the time being, hopefully that's given you a wee whistle-stop tour of where we're at present.
Many thanks, Keith. That was a great run through from the licensing side of things. Next up, we have Catherine Clark, Senior Environmental Health Officer from the Environmental Health team within Aberdeenshire Council. Catherine is going to cover risk assessments, environmental health mitigating measures and enforcement.
Thanks very much, Louise. Thanks for inviting me to speak this afternoon, and good afternoon to all the businesses that are listening. My name's Catherine Clark, and I work in a team with licensing officers and trading standards officers. And what we do is we deal with complaints from members of the public and any inquiries from businesses, and we try to help quite a broad range of businesses move forward through this coronavirus crisis. Today I'm going to speak to you about the approach you can take to put the guidance into practice. Especially as we move through this rapid change, it's very challenging for everybody. And I'm also going to touch on some enforcement powers. So Unfortunately, there's no easy shortcuts. So I'm going to run through the steps I think that you should take in terms of approach. So step one, you need to become familiar with the guidance that applies to the activities that you do in your business. Some of you will have a business where you're only doing hospitality, serving food and drinks, and it's likely then, as Keith explained, you'll just be looking at hospitality guidance. But as soon as you look at different activities, for example, playing pool, maybe sports or different types of entertainments, we've been talking about bingo and quizzes, then you have to consider the guidance for that specific activity. So you have to seek out where that guidance exists. A lot of it will be Scottish Government guidance. There's also industry guidance. And what to do is, if you're having problems with that, come and speak to us because we will put you in the right direction. There's also specific guidance for customer toilets. I'm asked quite a lot about cleaning chemicals, schedules, the Food Standards Scotland guidance for food business operators has a really good section on cleaning. So I would recommend, if you've got any queries about cleaning, have a look there first. I've also noted down face coverings on the slide there because that's something that we get asked about a lot. And it's a really good example about how challenging the whole situation is with the guidance and the regulations. So I'll just run through the scenario there. So if you were to research whether your staff needed face coverings, you might start by looking at regulations. And the regulations say that bars, public houses and restaurants are exempt from face coverings. And over the last few months, I've spoken to some businesses that have taken that quite rightly at face value. But it's not so clear cut. The hospitality statutory guidance states face coverings should be made available for front of house roles, and it would be expected that a risk assessment for front of house staff would indicate a barrier to control transmission is required. So basically what this is saying is the expectation is that your business's risk assessment would identify that a face covering is going or alternative screening is going to be required. So that explains where there's a bit of confusion there. So the next step is carrying out your risk assessments. And this is where you decide on the specific control measures from the guidance fit your business. Many of you will already have implemented a risk assessment. And so you'll know the importance of talking at this stage of talking with your employees and collaborating to make sure that you've got everybody on board. So I'll speak more about risk assessments later. The third step is to obviously train your staff in whatever the outcome of your risk assessments are, and to decide and to ensure that it's implemented and monitor check that your new ways of working are practical and effective for your business. The fourth step is to review your assessments, and there's really two periods where you've got to review them, and you'll have to, because everything's moving on really quickly, you're going to have to timetable time where you check the guidance for any changes. So you'll want to review your assessments if you're finding any of the measures you've got aren't working, and also you'll need to review your assessment when guidance changes. So it's always worth, when you're carrying out a little review of where you're at with the guidance, you want to put the date of the guidance that you've read at that time. So when you go back to have a look at the guidance again, it's got a new date on it, you know there's been changes. So that's a top tip there. So we'll move on to risk assessments. Risk assessments have been around since the early 1990s. And there's been a legal requirement on all employers to carry out risk assessment. So the change is that the transmission of coronavirus is now a hazard that you must include in those assessments. And the law states that employers with 5 or more employees must write those risk assessments down. So many of you will have already carried out that. But for those of you with less than 5 employees, I'd remind you that there remains a requirement to carry out risk assessments. If you don't write it down, you need to be extremely confident that you can explain those assessments verbally, and that is why we're really wanting you to keep a record right now. It's a means of proving that you have identified adequate, suitable control measures. Coronavirus controls, in my opinion, are not straightforward. So write the process down, write down what you've done, show that you've trained staff, and record your actions through this time to protect your business. So we'll move on to some examples of risk assessment. For those of you that have already carried out a risk assessment, it's quite a good thing to do during a review of your risk assessment to compare against some of the examples online. And those of you that haven't done risk assessments, it's a really good place to start. So the HSE on their website, they've published the COVID-19 risk assessment. It's not specific to hospitality, but it guides you through the process, and it gives you a sort of template to follow in terms of the areas that you need to risk assess. I've seen some really good risk assessments being developed from that, from food businesses and other businesses, so it's certainly a good start there. The Food Standards Scotland risk assessment tool is good because it's specific to food businesses, and it also includes a list of points to consider against each hazard, so it really takes you through that process. It's got particular sections for different types of food businesses, so it's definitely worth looking at that in conjunction with their guide for food businesses. You can employ, there's trade associations, you can employ a private company, that, which is absolutely fine, but you still need to know exactly what they're suggesting, and you need to implement the control measures. And at this time where things are changing so often, you might be in a situation where you have to invite them back a lot to review. So sometimes it's actually just better to develop your own system in your own words. And this is a really great way of showing your understanding of how you've actually implemented the guidance within your business. So I hope that's given you a wee brief outline of risk assessments, and I hope that's helped you, come up with a good approach that fits your business. So I said I would also touch on the regulations. Some of you will be aware that the new regulations came into force last Friday. We're at the moment, it's very early days, but we've been given powers to give directions to businesses, and it really extends the powers to close businesses, restrict entry, restrict numbers, restrict the purpose of being in a premises, and then there's also additional powers with regard to prohibiting events or imposing certain restrictions on events. But as Keith said earlier, we must stress that we don't want to have to use these powers. Our team really wants to work with businesses, and we want to find a way through this. And our current procedures focusing on engaging with businesses, explaining the guidance and encouraging adoption of guidance, and formal enforcement action is still the last resort. So I'll just, thanks for your time, and I'll hand you back to Louise.
Thank you, Catherine. Our final speaker of this afternoon comes from Police Scotland, and within the licensing team we've got Sergeant Jill Flett, discussing how they are supporting partner agencies and trade throughout the pandemic. So I'll hand over to them now. Thank you.
Hello and good afternoon. Just a quick introduction from me. My name's Jill Flett. I'm the sergeant in the licensing team here in North East Division. We actually cover the 3 local authority areas of Aberdeenshire, Aberdeen City and Moray. So we have a bit of a oversight of what's happening elsewhere in the whole Grampian region as such. Our actual licensing team is quite small. There's not many officers in it at all, and we deal mainly with the administration processes of applications, and obviously we're the ones who have been turning over these hundreds of occasionals that we've received in the past few weeks and couple of months. We also attend licensing boards, and we react to the issues and problems that are brought to our attention when divisional officers do attend licensed premises. So those of you who are in the trade, if you receive a visit, it is most likely to be the uniformed operational officers who are coming into your premises, usually on a Friday and Saturday night. And we provide guidance and support to these local officers. Our role here in this crisis that we find ourselves in is we see a supportive one. We're support with the LSOs, the environmental health officers, and with the trade itself. If officers are coming into your premises, if we see something that we think isn't right, that we think isn't in line with the current regulations or guidance, and we all know that it is a changing landscape, our first point of call will be to get the person who's in charge, get the duty manager, and discuss it with them and seek remedy that way. I would expect the operational officers to then put a brief report into the licensing team, that's to us, and we pick that up. And that's the information that we share on a daily or weekly basis with the LSOs, and they will consider what needs to go on to trading standards and environmental health. And we might discuss what action might be needed, whether the local authority, LSOs, might follow up and discuss the problem or the issue with the premises, or if they think it's more sitting with environmental health. But this information sharing is not new. We've been doing it for years, and we actually have proper protocols in place to allow us to do that, and we will continue to do that. So if officers come along and their opinion is that they see something happening which they think shouldn't be happening, then they're probably going to point it out, and then they're probably going to send in the report to us, and we're going to liaise with the LSOs and environmental health, and you might get a phone call, probably more likely from environmental health. I'm probably going to repeat some of the things that Keith Simpson, the LSO, has said. We too are guided by the 4 E's, and that is engaging, explaining, encouraging, and last of all is enforcement. Enforcement is a last resort, because ultimately what we want is to achieve compliance. Compliance by the people who are managing premises, and compliance by the customers who hopefully are going in and enjoying the return to venues. At the end of the day, this is a public health issue, and the issuing of fixed penalties or charging someone and reporting them to the Procurator Fiscal isn't in the immediate term achieving the effect of compliance. So if we can get people to do what we think needs to be done, because that's what the government is telling us is the current guidelines, then we will try and engage, explain and encourage. We all want the same thing. We're all trying to get back to operation of premises in a safe way in accordance with what is the current regulations and the guidelines, and we know it's tricky because every week something is changing and we also have to get our heads around it. From our perspective, and being a person who is based in Aberdeen, lives in Aberdeen and has been affected by the local Aberdeen lockdown, I think that what was probably an issue, and perhaps Dale Henderson has confirmed it, was the social distancing between groups who went into premises together. Perhaps at the outset, it maybe wasn't explicit that even a table of 4 or 3 or 6 who are going out, getting together, people who perhaps hadn't seen each other for a number of weeks, if not months, they, if they came from more than one household, had to be distanced. And I think that was, may well have been where things went adrift. Now that premises really are clear, because environmental health and LSOs have been, in each local authority have been very clear with the trade that this is what needs to be happening. When people are coming into the premises and they're giving over their contact details, that is the point at which you need to be establishing, okay, how many households do we have here? And the public do need to be educated and say, well, actually, folks, if you're from a different household, you'll can sit at the same table, but you are going to have to be 1 metre apart. Now, there's nobody underestimating the challenge that is for the trade, especially as perhaps the evening goes on and with the consumption of alcohol, inhibitions are lowered and people do want to be with their friends and people want to be back to where we were. But if your premises is starting to look like normal times, then something's gone wrong, because nothing's normal at the moment, and your premises won't look and won't sound normal at all. So that's really it from me. It is a brief input. We are here to support.
Thank you very much, Sergeant Flett. That concludes our presentations for this afternoon. So we'll now be moving to our question and answer session. We have a number of questions lined up for our panel. I'll do a quick recap of who's on our panel this afternoon. We've got Dr. Simon Hilton, CPHM from NHS Grampian, Dale Henderson, Principal Trading Standards Officer, Keith Simpson, Senior Licensing Standards Officer, and Catherine Clark from Environmental Health, in addition to Sergeant Flett of Police Scotland. Our first question this afternoon is in relation to the Aberdeen visits that were carried out. So Dale, this will be one for you, please. The question is related to the range of businesses that were visited and how the range was derived in reference to the 160 premises that were visited.
Yeah, certainly I'll answer that, and I'll also, what I'll do first, because I'll forget about it, is Jill Flett's comment about the households mixing. I agree totally with Jill. I live in Aberdeen as well. I know lots of people who were out and about, and in between the lockdowns, and you were hearing from people, and you were like, that's groups of friends that are going out, and people just weren't getting it, and you're trying to explain to people, yeah, I know there was 4 of you out, but you were meant to be distant. You all weren't meant to snuggle around a wee table together. So I think that has been a problem. We've emphasised that again to the businesses, but it's not just on the businesses, it's on people. We all know to stay 2 metres apart or a metre apart now. So people have to remember that. But anyway, the question, the range of businesses we visited, this was agreed on, I think, at IMT level, and there was two criteria. One was basically there was a requirement to visit all bars, all pubs in the city. There was also a requirement, all the businesses that you saw named as having a person who'd visited who had been diagnosed with COVID, who was COVID positive, they were put on the list as well. And then there was a few randoms. It was just we started adding, because of that, we had a couple of like social clubs, so we added a few more on. And quite honestly, I just went through the list of social clubs and went, that's kind of more just like a bar, I'll add it on. But it was, in essence, it was bars. So if you were in the city centre and it was a public bar, that's what we did. But there was the odd restaurant on there as well. I say it worked out at about, our list was 170 odd. Some businesses are not open yet, so I think we've visited 166 so far.
Thank you, Dale. Our next question this afternoon is relation to background music, and the comment is that the absence of background music can actually lead to people to lean in closer to speak due to low levels of conversation. Is there any word on when this might be reviewed? I will pass to Catherine Clark to answer that one, please.
Hi there. Yeah, thanks, Louise. What I would say is that all the measures are under constant review. There are special working groups that are set up in conjunction with the Scottish Government, and I know these matters are being considered. Unfortunately, I don't have any dates as to when we would get any changes with regard to background music, but certainly if we hear anything, we would definitely inform our premises that we communicate with as soon as we can. So unfortunately, I can't give you any straight answers at the moment with that one.
Thank you, Catherine. The next query is one I will pass to Dr. Hilton. It's in relation to the authentication of name and address details for the track and trace purposes and concerns around people providing false information. And do you have any advice surrounding how to minimise false information being given and just the importance around this, please?
Yeah, I mean, I suppose in terms of the importance, I mean, obviously it's really this bit, going back to what I was talking about in terms of test and protect and contact tracing, and just that there are times when we may be able to identify, or we should be able to identify, mostly contacts through speaking to people who test positive and speaking to their contacts. But sometimes, obviously, we need the help of premises to do that, and that's where the collection of the details comes in. In terms of actually how to minimise the risk of people giving incorrect details, I really don't know. I mean, we are, you know, at the end of the day, we are very dependent on people wanting to support each other through the pandemic. There's something about the realization that, you know, this pandemic obviously is something that affects all of us. And so people giving false information obviously isn't helpful to anybody. And I guess it's just really emphasizing people's social responsibility to each other. I don't know if my local authority colleagues have got any practical tips, but I think at the end of the day, if somebody is determined not to give their own details, I'm not quite sure practically, as I say, other than kind of encouragement and giving people the reasons to give the correct details, what else we can do.
Thank you for that. Yeah, everyone has a responsibility here to support our businesses in providing that information for their own sake, the sake of the staff and other customers that are present at that time. And there's a variety of methods that are open to you to collect that information. Our next question is for Dell, I believe, and it's in relation to bingo sessions within a licensed club. And this is in relation to the differing guidance for different activities. Which distance measure do I need to adhere to? The bingo hall 2 metre distance or the licensed hospitality distance of 1 metre?
Yeah, this is a question that we've been trying to address in Aberdeen as well. And I hope I'm not going to say something different from my colleagues in Aberdeenshire. We have worked on the basis that if what we're talking about is a golf club or a social club, so people are going in and having a drink and sitting at 1 metre, and then a bingo session starts, then we think it's going to be a bit odd to ask all the players to suddenly move 2 metres apart. What we have suggested is some practical measures. You know, there's measures from, you know, collecting the bingo cards in the first place, is you know, make sure there's not queues, people are not too close, sharing the dabbers and things like that, that's always a problem. If you're giving out cash prizes, what we're suggesting is that it's put in an envelope and it's handed out and people are asked not to open it. I know what happens, people open it and go and spend the money at the bar, but you can only ask. So we in the city, I think, are quite happy that we put it to 1 metre. What we have, the big thing is when people shout out. So when people shout for their win. So it could be that you suggest to the players that they might want to wear face coverings, but we're saying don't shout out. One of our clubs in Aberdeen, I can't remember where it is, they've got squeaky toys that they clean. That's their thing, they've got squeaky toys. So every player gets a squeaky toy, and instead of shouting house, they've got a squeaky toy. The other suggestions is putting your hand in the air. I think I think we need to avoid people shouting out. So you may want to, if you can't think of any other method, then require your players to wear face coverings. But I think it's naive to think that people are going to move 2 metres apart to play bingo. I hope Aberdeenshire don't think differently.
Thank you, Dale. That was most helpful. Our next question this afternoon is one for Keith Simpson, our Licence and Standards Officer, asking, will the LSOs be looking for documented evidence of COVID-19 staff training as they currently do for licensing training?
Yes, thanks, Louise. Before I just quickly answer that, I'll maybe just go back and confirm that I would go down the line of what Dale suggested with the bingo. I think we would adopt that sort of scenario where we would be happy with 1 metre if it's in a registered club or whatever. So just to say that I would be on the same page as Dale on that in the city. To answer the specific question, obviously, the 2-hour staff training under the Licensing Scotland Act is mandatory, and obviously from an LSO's perspective, we would be looking to have that documented officially. That would be part of your the mandatory conditions of the licence, so that's an absolute. When it comes to COVID-19, I don't necessarily think there is that same mandatory requirement. I think what we would have is almost like a general expectation that staff had sight of, say, your risk assessments and had clear instructions on how to adopt the measures that are in place and maybe sign that off in some respect. So yes, we would be looking for it, and we would like to see it. But at the end of the day, it's probably not a mandatory requirement. But hopefully, if everybody's willing to comply with that, then that would be great. But there's a slight difference between that and what the Licensing Act says.
Thank you, Keith. Our second last question so far, unless there's any others that come in, is in relation to the local fiddlers that practice in the social club. They're keen to get started again. Not quite sure if that's in relation to practice or live events. And is there any indication when this type of event can start again? So I'll pass to Catherine Clark, who can give a bit of an overview on the information provided.
Yeah, thanks, Louise. So this is a really good example of how actually complicated it is to decide where you sit in the route map in terms of when you can start to do activities. So we'd really need to make the decision about where this sits. You need a lot of information. Is this outdoor practice or indoor practice? Is it a gathering? Is it when the social club's open to others? Could it be viewed as entertainment? So we would really need more information to give you advice about the potential of where it could sit within the route map. So please come to us with further information, and we'd be delighted to help you.
Thank you, Catherine. Our final question relates to more a comment sought from the panel in relation to frustrations from businesses where there's increasing conflict between publicans and customers, with complaints being passed over to licensing officials rather than customers perhaps not addressing their concerns direct with the business at that time and providing an opportunity for them to rectify any issues. There is customer guidance for premises that they may wish to utilise to help them educate customers in relation to this, and that's been put together by the Scottish Government, and that link can be posted up into the chat, and we can make sure that that's circulated, and hopefully that will assist with that comment there. I'd like to take this opportunity to thank you all for taking time out of your day to listen and put your questions forward. And we really appreciate the support that you've provided and the information that you've provided to officers when requested, as we all try to work our way through this. Thank you to all of our speakers this afternoon. A fantastic lineup from a number of partner agencies that hopefully gives you an idea of the complexities behind all of the different jobs involved in supporting the hospitality sector tackle the challenges in front of us. And with nothing more, I think we'll say goodbye and thank you again, everybody, for joining us.